after a significant rise in coronavirus cases, Boris Johnson tonight warned that a second wave of the pandemic is coming. More than 3 million people in England have now been told they'll face tighter restrictions from next Tuesday, with Merseyside, Lancashire and parts of the Midlands and West Yorkshire coming under the same local rules now in force in the northeast of England. The NHS Nightingale Hospital in Birmingham is also now on high alert. The Prime Minister says he doesn't want another full-scale national lockdown and he's determined to keep schools and businesses open. But he says it may be necessary to review whether tighter restrictions right across England are necessary. Our first report tonight is from our chief political correspondent, Vicki Young.
The life we used to lead can no longer be taken for granted.
We have to do something to get rid of it. It's like fighting a war against something we can't see.
Across the UK, governments have been trying to slow a second surge of coronavirus with local restrictions.
It is confusing. Like 1 minute they're encouraging us to go out like Monday, Tuesday, Wednesday, lunch, dinner, drinks, and then the next minute the police are around banging on doors, chucking everyone out of houses.
In Wolverhampton, they're preparing for further curbs on socialising from next week. Coronavirus is no longer a local problem in a few hotspots.
It's going to get bad again, I reckon. There's no lockdown anymore here. Like, no one's taking notice of it.
The Prime Minister was in Oxford today, visiting scientists trying to develop a vaccine.
That's fantastic. That's like Jurassic Park.
But until they succeed, the government will consider tighter restrictions on everyone.
We are now seeing a second wave coming in, and I don't think anybody wants to go into a second lockdown. But clearly, when you look at what is happening, you've got to wonder whether we need to go further than the rule of 6 that we brought in on Monday. So we'll be looking at the local lockdowns we've got in large parts of the country now, looking at what we can do to intensify things there.
Over the summer, the government's been talking about the path back to normality, encouraging us to spend money in restaurants and return to the office. They're desperate to protect as many jobs as possible, but they have to protect lives too. COVID cases are now doubling every 7 to 8 days, and that's prompting a rethink. In England, ministers are considering tighter restrictions for everyone, a so-called circuit break. Parts of the hospitality sector could be asked to close for a short time, but schools and workplaces would be kept open.
This virus is on the rise again.
Leaders of the devolved nations are calling for an emergency meeting with the Prime Minister this weekend.
The coming days are likely to see some hard but necessary decisions. If we want to avoid another full-scale lockdown, which all of us do, doing nothing almost certainly isn't an option.
There is a vacancy at the heart of the United Kingdom, and it needs urgently to be filled, so that we can talk together, share information, pool ideas.
The Labour leader says problems with the testing system mean it's much harder to control the spread of the virus.
This feels very much like we were in February, and so we need quick, decisive action on a national scale from the Prime Minister. He needs to set out what he's going to do and reassure the nation. We will support him if he does that.
Many are enjoying these last days of summer, but ministers are already anxious about the severe challenges ahead.
Vicky, this is a marked change in tone from the government.
Yeah, I think the mood in government tonight is pretty gloomy. They have a testing system which is under strain, an economy that's under strain, and that strategy of stamping down on the virus in isolated hotspots, well, it feels like we're way past that. The Mayor of London tonight saying he thinks restrictions will soon be needed in the capital. And the Prime Minister being much more direct than he has been before, talking about this second wave that's coming. So the big question, what are they going to do about it? There are several ideas being discussed. One of them is this short, sharp shock, if you like, these restrictions being brought in for a short amount of time nationally. But the BBC's learnt about another plan that was discussed yesterday. This is about a 3-tier approach. The first tier would be social distancing measures. The second one, a ban on households mixing and curfews on pubs and restaurants. We've seen that in many parts of the country already. And the third would be a stricter lockdown. We understand that shielding is also under review. But of course, the problem the government has is if they want to suppress this virus because there's no vaccine available, many of these restrictions will be needed for several months. There are some very difficult decisions ahead, and ministers don't have long to make them.
OK, Vicky, thank you. Vicki Young there at Westminster. So, with the rise in cases, what are the new restrictions millions in England will be under from next week? Well, there'll be no socialising with other households in private homes and gardens. Pubs and restaurants will be required to shut by 10 o'clock, and public transport can be used, but only for essential purposes like going to work. And these are the areas that will be affected from Tuesday, including Liverpool, Wolverhampton and Bradford. The new restrictions being the same as those that came into force across the northeast of England and the northeast of England later on today. Now, these new measures follow other areas in the UK currently under local restrictions: Bolton, Birmingham and Glasgow. Here's our special correspondent, Ed Thomas.
New rules are coming to go alongside COVID rituals.
33.6, that's low.
I'm okay. Can I come in?
No, we've got to do your hands.
Inside Paula's hair and nail salon.
That, and then we've got to wash.
You are taking this super seriously.
Yeah. These people are very dear to us.
All to protect people like Carmel, 81, with the lung disease COPD.
Do you support what's being done?
Yes, definitely. I think really we could have done with a complete shutdown for a couple of weeks, everybody, and then I don't think we would have a problem.
And you'd feel safer with that?
Yeah.
With COPD?
Yeah, definitely.
Good job you're in our bubble.
There's a fear here. These new rules are too little too late.
Our households can't mix on Merseyside, pubs, clubs closing.
It's ridiculous. It's ridiculous. It should have been done months ago. I think we should have stayed in lockdown till at least the end of this year.
But what about the economy? What about people with other conditions?
That's it. I mean, I'm not scared of catching the disease. I'm scared of what it's doing to our society. As a country, are we ever going to get over this?
From Merseyside to Lancashire, millions of people face these new restrictions on mixing. So what next? For best friends Sam and Kim.
Who's going to have the kids for me?
Sam is waiting for bowel cancer test results. Kim suffers from acute anxiety. They need and rely on each other.
What is your reaction to it?
Pathetic.
Why is it so important that you see your friend?
Because I've got mental health issues and she's got mental health issues.
Yeah, anxiety, depression, I've had it since Christmas and I've been really, really bad since then. And then as soon as the lockdown come in, it was 10 times worse.
But they don't want to go back to April with thousands of people dying every day.
Yeah, I understand that. Do they even live like we live? Do they understand the impact that they're having on normal, everyday people?
And for now in Chorley, the show goes on. Circus Mondeo performs across the northwest of England. But the places where they can go without audiences facing tighter rules is getting smaller. A business under pressure.
The knock-on effect is people don't come, and if people don't come, we'll have to pack it all away and head off home.
Are you worried that this could end this business?
Oh, it could. Yeah, there is a great possibility that it could. But we also need a bit of sunshine in our life, a little bit of entertainment and something to smile about, and that's what we're trying to do.
Tonight, public health leaders say they had to act. They need people here to follow the new rules, to bring infection rates down and prevent even tighter restrictions. Ed Thomas, BBC News, Liverpool.
Well, the latest government figures show the highest daily number of new infections since the current surge in cases began, with 4,322 new infections in the latest 24-hour period. That means the average number of new cases reported per day in the last week is 3,466. And as new cases have climbed, so have daily hospital admissions, with the weekly average at 221. Data from Scotland on this is only published up until September the 7th. 27 deaths were reported of people who died within 28 days of a positive COVID-19 test. And that means, on average, in the last week, 17 deaths were announced every day, taking the total number across the UK to 41,732. Well, there are now more than 1,000 people in hospital with coronavirus across the UK, and this, along with continuing reports of serious problems in the testing system. Here's our health editor, Hugh Pym.
There are yet more stories of delays and frustration at virus testing sites. Traffic came to a standstill in South London as people who'd booked tests waited to get to the location they'd been told to go to. But at the site there was no testing, just officials saying the bookings hadn't been registered and people should leave and try again. Leah has symptoms and was driven down by her husband to get a test, enduring the heavy traffic, but not getting what she needed.
It was very upsetting, to be honest, because we were desperate to get a test. And we'd tried for so long, only to be turned away. And it takes so long to go through the process. I've also I've lost the will to do it.
Other testing sites were open, but most were fully booked. Demand for tests has surged, partly because of an increase in coronavirus symptoms and cases. One guide to what's happening comes in a random survey of people in the community by the Office for National Statistics. It picks up those who don't realise they have the virus. In its most recent week, the survey shows that nearly 60,000 people in England were infected. Now, that's a lot fewer than in May, but the previous week it was fewer than 40,000. That means 1 in 900 of the population in England were infected, with the highest rates in the northwest and London. In Wales, by comparison, it was 1 in 2,000. The survey doesn't cover the rest of the UK. Health officials are concerned that the numbers seriously ill in hospital with the virus are now rising, a delayed reaction to the spread in the community. Admissions of patients to hospitals, some needing intensive care, have doubled in about a week across England.
We are at a point where we are now seeing critical changes in the number of infections in hospitals. We're seeing a rise that's slower than happened in March, but nonetheless, if it continues to rise in the same way, we would expect to see similar numbers that we had in hospital at the end of March in about 3 to 4 weeks' time.
So the big question now is how much faster the virus will spread in communities and how many will need hospital treatment.
How much, for how long? Of course, this is anybody's guess, but it's also not inevitable that how steep the curve up is going to be. So the UK can write its own history. And so it's very important that as fast as possible, as effectively as possible, we put measures in place.
Whatever those measures are, ensuring that the testing system is working properly to track the virus seems as critical as ever.
Hugh, I mentioned to Vicki Young the change of tone from the government, but this transformation of mood has been at lightning speed.
Well, yes, Clive. If you say to people there's 1,000 in hospital, some might say, well, at the peak there were more than 19,000 in April, but it's the speed in the growth of the numbers. As we heard there, hospital admissions in England have doubled in more or less a week. And in fact, Public Health England are saying they're particularly concerned at the number of hospital admissions amongst older people over the age of 80 or so, because of course the worry was when earlier this month cases started picking up, particularly amongst younger groups, that this would spread across the community to older members of society. Then, of course, you've got the R number, which tells you how rapidly the virus is spreading or declining. Anything above 1 means one person's infecting more than one other. The top end of the range now, estimate, has gone up to 1.4, and the modelers who draw it up say that the number of infections could be doubling now in less than 7 days. So that's the real worry. If you let it get out of control, it continues accelerating. And that is why these measures we're talking about tonight are now being considered preemptively. It's the same in other leading European economies like France and Spain. They've got the same problems. France reported 13,000 more cases in the latest day. It's a question of getting the balance right to intervene in good time. And of course, the public doing their bit with social distancing.
OK, many thanks, Hugh. Hugh Pym there.